This is Donna Foster Paulsen, and she is a patient of Dr. Samuel, so we're going to be talking with her today.
Hello.
Hi, Donna.
Hi.
Hi, Donna. So, thank you very much for joining us at today's live webinar. Very grateful to you for sharing your experience with us and with our audience. So, Donna, tell us and the audience a little bit about your background. You're 47 years old, you're married and 2 children, and you balance working and training. And so tell us a little bit about that.
Yes. Well, I think you pretty much said it all, but yeah. Almost 47, married with 2 children, 2 dogs, and I work part-time here at the University of Iowa Hospitals and Clinics. I work in the Department of Clinical Quality, Safety, Performance, and Improvement. My job is a performance improvement area. And I'm a full-time grad student working on becoming a family nurse practitioner. So that's a little bit of my background.
So back in October 2014, you first came to our program. And tell us a little bit about your experience on that first visit.
Well, if it's okay, I'd like to back up and talk about my weight loss journey, like where
Sure.
I started. So I wanted to say that, you know, as Dr. Smith was mentioning, that patients have had obesity or problems with their weight for many years. And mine, actually, when I look back at it, I see that it's a journey that started when I was about 9 years old, is when you can see in the pictures. And I had problems losing weight and keeping it off, and ended up throughout my lifespan yo-yo dieting up and down, up and down. In 2004, I married my husband, and about 1 year later we had our son, and I gained about 70 pounds with that pregnancy and was unable to keep it off. And I would use numerous different types of dieting and exercise, and I would lose the weight and then gain back more weight, lose the weight and gain back more weight, till I topped out to about 249 pounds. I had been exercising almost every single day, but I could not regulate my eating habits of what I was experiencing. And at that point, I decided to do some research on bariatric surgery. Actually, prior to that, I went to a vacation with my husband, and I went on a ride with him, and we got kicked off the ride because our total weight together was over 500 pounds. And that was, I think, one of the light bulbs that kind of clicked in my head, like, do I really weigh that much? Oh my, you know. And in the fall, I was working with other coworkers. I had one coworker that had a gastric bypass, and I told her about the incident, how embarrassing it was, and she consulted me and said, you know, I've had a bypass, and I wanted to talk to you about that. And so her experience, and she had been 2 years out, and still with the weight loss off, and I was very interested and intrigued. So then I went ahead and researched your website online, and then realized that I think this is the right route. You know, I wanted to go in at first just to kind of see how it was, get a feel for it.
So I gotta know, have you been on another roller coaster?
I have not been on another roller coaster yet, no, but maybe this summer when I get on a ride again, then I won't get kicked off for weighing too much. And it'll be kind of surreal, I'm sure. I know it's the little things like that. You know, it's not being able to use the seat belts. It's having to have an extension on the seat belts. It's the seat that you're sitting in is uncomfortably small because of your size, and it's embarrassing when people stare at you and snicker. You know, so it's these are things that really kind of hit home, and then of course pictures. You don't really know that you're overweight, but you don't really know until somebody takes a picture of you, and then you see the picture, and you're, well, wow, you know, I don't really remember myself being, I didn't realize it, you know. I mean, I knew it was there. I guess it's a course of denial, but that was the reasons why I came to your clinic to meet your team.
Sure. And just to give the audience a little more background, Donna's maximum weight was about 249 pounds in 2013, and her body mass index at that time was 39. The normal range is 19 to 25. When you go above 25 body mass index, you're considered overweight. Above 30, you're classified as obese. Then above 35, you're classified as severely obese. So Donna had a surgery in March of 2015, and she had a laparoscopic sleeve gastrectomy. And so this is 9 months today, 9 months post-operatively after her sleeve. Now she weighs 174 pounds, and her body mass index is 27. 27 is very close to normal, and it's well below a body mass index of 30, which is classified as obese. So Donna is no longer obese now, and she's still losing weight, and there's a very good chance that she can reach a normal body mass index. Now, along with this weight loss, what we see with this dramatic surgical weight reduction is improvement in the comorbidities or the complications of obesity. So do you want to tell us a little bit about how your life has been impacted, and your life in general, and also the comorbidities in specific?
So, you know, I think I talked about, I had a lot of body aches that, you know, just general aches and pains that was not from working out. You know, that my feet ached all the time, my knees were hurting all the time, my shoulders, my body in general. Those were significantly impacted and decreased to actually almost zero. You know, I had to take a blood pressure medication that I was on, and that blood pressure medication was dual reasons. It was to control I had some fluid retention, and also I was borderline hypertension. So after the surgery and the weight started to lose, I just decreased the medication. It's gone. So that's a positive impact. Just the everyday life journey of going up and down stairs, where I couldn't go up 3 flights of stairs without stopping and have to catch my breath for a minute or two. And now I can go up and down the stairs pretty easily. I'm still a little winded, don't get me wrong. I'm sure most people do get a little winded, but I don't have to stop and catch my breath, and wasn't able to hold a conversation.
Yeah.
So those are, you know, significant.
So I've known you for a long time prior to this. She's actually a friend of mine, which is a coincidence. But so I've known you through the gym.
Yes.
And you, I know, before surgery, you've worked so hard trying to lose weight. And I am humbled by your efforts at that. You were there a whole lot more than I was. so tell us a little bit about that.
Well, you know, I went to a gym. I signed up at it was like a Farrell's gym membership. Did I think a 10-week, 10-week trial, and I loved it, and I continued to do it. And I would work out 6 days a week, which is a 6 days a week routine that they have. It's very intense, high impact interval training, and but I still couldn't successfully lose the weight. The whole eating in full and your brain not knowing when you're full. I didn't have that. It wasn't there. And then a friend of mine told me to try a different gym, and I obliged a title boxing gym where there wasn't, you could do the high intensity interval training every single day. So it wasn't Monday, Wednesday, Friday, and Tuesday, Thursdays, and Saturdays you did resistant training. It was high intensity training every single day for 6 days, 7 days a week if I wanted to. And I still couldn't lose the weight. I still, you know, couldn't manage to control the eating. So this is something that, you know, was very frustrating to me, And going to the gym, I could do these activities. I felt great afterwards, but I still could not produce the weight that I wanted to. But I'm very proud to be a member of this gym. And most recently, we had a fundraiser there for Dance Marathon. I'm an active Dance Marathon mom. We have a child that was diagnosed with cancer when he was 2 weeks prior to turning 2. And he's in remission now and has been in remission since then. But they have a fundraiser that they do once a year for the big event, which is coming up on February 5th here at the IMU. And there was a fundraiser of doing 5 classes in a row, which, mind you, these are 60-minute classes of intense boxing for 5 hours. And there was only 7 of us that could do it. I was one of them, and I'm very proud to say that I was able to do that with, I'm very proud that I was able to do that. And I wouldn't have been able to do that prior. I could probably maybe do a class and a half. But to be able to do 5, which I don't recommend anybody doing 5 in a row. That's not what I'm trying to tell you to do. But it was a fundraiser. But it was.
But you feel like after bariatric surgery,
after bariatric, I had the
possible.
Endurance was there. So I didn't have the endurance before I do now, and I'm able to continue my journey. This is a wonderful journey.
Yeah.
A lot of ups and downs.
So now 9 months post-operatively, with the body mass index coming down from 39 to 27. You're no longer hypertensive, your blood pressure is normal without being on your pill. And in addition, you used to get exercise-induced asthma, which has gone away, and you're not on inhalers for that anymore. And you used to get these upper respiratory infections, which are much less frequent now. And you also had excessive uterine bleeding, which is also resolved, or much better. And your sense of the fitting of clothes is also a big impact in your life.
It is a very big impact. It's a lot of times you don't even know what size you are through the journey. You have to really, you don't know where you're at. You're going in, you're trying on all these different clothes, and then you're pleasantly surprised. Wow. I went from a size 18, 20 to now a size 8, 10. I went from a size 10 shoe to a size 9 shoe, which you wouldn't even imagine that your shoes would actually fit better. Yeah, these little things like that, you're just like, wow, that's amazing.
Yeah, so the other day you mentioned something I'm kind of jealous of. I've had this upper respiratory crud for about a month now, and you said that you're actually having less of that even after surgery.
It's surprisingly for many years, every for the past 12 years, every winter, every fall, every spring, I would have some major upper respiratory infection, at least 2 or 3 times, and couldn't seem to manage to get rid of it. Even with the recommendation of flu shots, even with the flu, that kind of thing. So I have had almost hardly any. So it's very impressive. I'm very excited about that. Who knew? I didn't know that.
Maybe coincidence, but
it may be coincidence, but it's definitely.
It's surprising the number of things people are finding out that obesity can affect, and where surgical weight reduction can impact. One example is migraine headaches. In our program, we published a paper showing that migraine headaches can improve with surgical weight reduction, and nobody even expected that. That was quite a surprise. But then the feeling is that there are certain inflammatory molecules in the body called cytokines, and adipose tissue, which is the fat cells. The adipose tissue produces a lot of cytokines, and therefore the cytokine burden in the body is higher. And that can stimulate the brain to result in headaches or even migraine. And also things like asthma and pulmonary problems. So when you have dramatic weight reduction, your adipose tissue volume and mass goes down, and therefore your cytokine burden goes down. And that's one big reason why many of these inflammatory conditions improve. At least that is the hypothesis.
Yeah, I haven't had to use any asthma medications at all.
Excellent. So now that you're in 9 months, you've come down to a body mass index of 27, which is very close to 25. I have a very good feeling that you could reach 25 or below.
Yes.
And now you have to think long term.
Right.
And long term, what is your plan to maintain that body mass index?
Oh wow! So long term, you know, it's hard to see ahead of how well you're going to do. But I think some, you know, having a really good support system and being able to write your daily intake down in a diary, any kind of diary, planning ahead of what you're going to eat, thinking ahead of how you're going to eat. You know, these are all ways of improving, I think, to me, in my mind, that is going to encourage or keep the weight off in the future. You know, it also helps that, you know, that I have that signal there, you know, that I don't think I ever really had it, you know, that tells you that you're full when you eat, your stomach to your brain. So the advantage of the surgery is that, I mean, it's there, and it says, stop. So it's kind of nice to be able to, you know, to have it, and you really, you know, you're satisfied with what you've eaten.
Yes.
So.
And long term, the most important things are continuing dietary compliance and physical activity. With the diet compliance, you've been coming regularly to our clinic. I'm sure that reinforcement helps you, and then you also mentioned the online support.
Oh, yes, yes. So I have a online group on Facebook that is called March Sleever. So it a lady who opened the group up for anyone who had a sleeve done in March in 2014. And so there's about 200 of us in there, and we're, you know, we very much support each other very positively. It's very positive reinforcement. I think that's really important to understand when you're going through this journey, is to try to remain positive about it. It's very easy to you know, get yourself down, and especially when you don't see the numbers moving like you want them to. You know, so once a week, and I stress once a week, not every day, we have a weigh-in. So every Sunday we weigh in, and I post it on this website, and everybody follows in with how they're doing, and I try to give every single person, and everybody else jumps in, you know, this positive reinforcement. You know, if they had a bad day, if they had a bad week, okay, well, tomorrow's a new day. You know, let's pick up tomorrow and go from there. So, you know, and it's going to happen. You're going to have good days, you're going to have bad days. You know, but just to try to find a positive group. It doesn't have to be an online support group. They have the support group here once a month that you can go to on Tuesdays. And your family support is really, really, really important to be there for you. It's not always something that everybody's going to have. You know, some people may be going through this journey alone, but to be able to connect with other people, if you can, that have gone through the same procedure. It's very nice to know that they've gone through what you've gone through. They know. So it's nice.
Yes. And this continuing physical activity with the title boxing, is there also a group activity?
No. Well, I could join a group activity with them. Is it a group activity?
When you do it.
Yes, it is a group. I'm kind of one of those persons where you know, everybody has a different physical activity they like to do. Some people like to work out by themselves. Some people like to work in groups. Some people have a gym in their home. If they more to it, they can do that. Unfortunately, I have to be with a group of people that are doing it. It's kind of a competition thing, where if you know, somebody next to me is hitting the bag harder, I'm going to hit it harder than them. It's a group atmosphere that you know, everybody is cheering you on to try to continue to go. You know, but you know, I have to stress that you really have to be determined that this is what you're going to do, not just join a gym and not go. You know, you need to. Your first step is to go and to be there. You know, and really put in, you know, hard work and dedication. You know, that's exactly what it is.
And now that you've got so good at title boxing, does that frighten your husband?
No. No. Maybe my kids, but no.
She had a picture on Facebook.
Yes.
In these big, giant boxing gloves.
Yes.
They were about this big around after she did those 5 rounds.
Yes.
It's pretty funny.
Very proud of myself. It was a very surreal moment. Very proud. Just you know, similar to the wedding dress I just was recently able
Yes.
to put on my wedding dress. The last time I was married, or last time, I've only been married once. When I was married, I was 175 pounds, and today I'm 174.8. And not too long ago, I put that wedding dress on. I wasn't able to do it before, so to be able to get into it, and yeah, I took a picture of myself and I posted it on Facebook because I was very, very excited that
Excellent.
that was, you know, that's a victory for me.
Yeah,
Excellent.
We're beautiful.
Wonderful.
You always are.
Oh, thank you.
So one last question. The impact of the surgical weight reduction, the dramatic surgical weight reduction, the impact of that on your mood and daily life?
It definitely has been a significant improvement. So, and I also, you know, stress that the exercise is very important as well too, to increase your moods. Every time I go to the gym, now that I am able to have better endurance at the gym, that when I do get done doing training there, that I'm very happy. You know, this is the training to me at the gym is, and this journey is about, you know, my time to myself. I haven't had that time to myself before. So when I go to the gym, I don't think about anything else. It's for me and me only, and trying to breathe. And but afterwards, I'm very calm. I'm very happy, and I think that's is very important to have.
So on the whole, your mood is much better. You're much more active, and you're much happier.
Yes.
Thank you so much, Donna.
Thank you.
Thank you for joining us today.